time we got it. Hi, my name is Carly Lizer, and this is Devin Gear. We are presenting on safe sex to prevent STDs and pregnancy. So in college-age women, the pregnancy rate is about 15.4%. And of those 15.4%, about 43% have abortions. The finding for this was that typically women felt that they didn't have the resources or weren't financially stable enough to have the child, or if they were to have the child, they weren't able to continue their college education. We are going to teach about different ways to responsibly and safely have sex so that you don't have to run into these same issues. So next we will talk about STD prevalence.
So what are STDs? STDs are infections that are passed from one person to another during sexual activity. Anyone is at risk for STDs if they are sexually active. They are passed through oral, anal, and vaginal sex, genital skin-to-skin contact. Basically, if you are touching the other person's fluids, you can get an STD. How to participate in safe sex? One of the best ways is to use a condom, a dental dam, or gloves, as these are barrier methods. Getting tested regularly for STDs. STI prevention. Abstinence is, of course, the best method, the only true method. Vaccination can help prevent HPV, decrease the number of sexual partners. You can stay faithful to your partner, mutual monogamy, and the use of barrier methods such as condoms, like we've already stated. STDs passed through vaginal or anal intercourse include chlamydia, gonorrhea, syphilis, HIV, herpes, HPV, and genital warts, hepatitis B, pubic lice, scabies. STDs passed to infect your lips, mouth, and throat include herpes, syphilis, gonorrhea, HPV, and hepatitis B. Sorry, I'm reading right off of here, but it's a list. I'm not going to memorize the entire thing. STDs passed with skin-to-skin contact include herpes, HPV, and genital warts, syphilis, pubic lice, scabies.
So now we're going to talk about different forms of birth control that you can use and their effectiveness. So obviously, as we already stated, abstinence, that's the only true one that works 100% for both pregnancy and STDs, because obviously if you don't do it, you can't catch it. Abstinence is the action of not having sex. The definition of abstinence can vary from just not doing anything to doing everything but having actual intercourse. The pros to using abstinence is that it's easy to use, protects against STDs, and you always have that option. The cons about that, though, is that people get pressured by their friends or partners to have sex, and sometimes it is hard for them not to act on sexual feelings. Another form of birth control are IUDs. IUDs are small devices, they're kind of shaped like a T, and they're implanted by a healthcare worker up into a female's uterus. There's two types of them. There's a hormonal type and a copper one. These stop the sperm from fertilizing the egg, and the hormonal ones also thicken the mucus in the cervix to make it harder for sperm to enter, because obviously if it can't get in, it can't get you pregnant. The pros to this type of birth control is that it's always in place. They actually last from 3 to 10 years, depending on the type, which is awesome because once you get it in there, you are safe for a couple years. It doesn't interfere with sex, and the hormonal IUDs can actually lighten your period or completely stop them since it's a constant dose of hormones. The cons is that the copper ones can actually increase your bleeding, and they don't protect against STDs.
So the implant, what is it? It's a tiny rod placed under the skin of the arm, and the rod slowly releases hormones into the bloodstream. It stops the ovaries from releasing an egg every month, and thickens the mucus in the cervix, so it makes it harder for the sperm to get into and pregnant. The pros, it can stay in for 3 years. It's always in place, and it doesn't interfere with sex at all. The cons, it is unknown how it can personally affect your periods. You could spot lighter, heavier, or none at all, or even I've known someone who just had horrible fatigue from the moment she got it in until she had to take it out. So it can also cost anywhere between $400 to $650. I mean, that's obviously a range. It could be lower or higher depending on insurance and everything. Another con is it does not prevent HIV or STDs.
Then you have the Depo-Provera, which is the shot. So it's a shot of artificial hormones. That also stops the ovaries from releasing an egg, and it thickens mucus in the cervix. These last for 3 months, and you have to go back to get one. So that's one of the pros. It can also decrease your cramping, doesn't interfere with sex. This one's also safe to use when breastfeeding, and it lessens your chance of getting endometrial cancer. The cons of it are that, like a lot of birth controls, it's unknown how it can affect you personally, but with this one, once you get it, you can't remove it until your 3 months are up. Also, you have to go back to your doctor every 3 months to get it, which might be hard for some people. This one can also cause weight change, moodiness, headaches, and dizziness, and like a lot of the others, it does not prevent HIV or STD infections.
Pills, patches, and vaginal rings. What are they? They all release artificial hormones in different ways that stop the ovary from releasing an egg. They all thicken the mucus in the cervix. Pros, they're simple and easy to use. They often decrease cramping and bleeding. They don't interfere with sex. There's less a chance of PID with pill. And some pills can decrease the number of periods that one would have in a year. And there are less chance of endometrial or ovarian cancer with the pill. Cons, may not work properly in women over 35. Not ideal for breastfeeding. May cause weight change, moodiness, and spotting. And there are no HIV/STD protections.
Then we have condoms, which this one is one that's targeted more towards males, as a lot of the other ones were all towards females. So condoms fits over an erect penis and it catches the sperm released during ejaculation. The pros of this is anyone can buy it at a drugstore. It's easy to use and it's easy to keep on you. You only need to use it when you need it. You don't have to keep it in like all the other forms of birth control. And latex condoms prevent STD or HIV infections.
If used properly.
Yeah, if used properly. Or they don't rip. Cons is that obviously it has to be on, and that the latex can irritate penises or vagina depending on the person's skin. Then we have a diaphragm, which is a small latex or silicone cup that covers the cervix. Usually this is used as spermicide, and the only thing about this is it has to be fitted by a healthcare provider. The pros is it can be put in up to 6 hours before sex, and it only needs to be used when you are about to have sex. The cons of this is that for some women it's hard to take out or put in. It can get kind of messy. The cream can irritate your skin, and it has to be left in for up to 6 hours after you have sex. Also, this one does not prevent against STDs.
So for preventing pregnancy, there's the withdrawal method. What is it? Basically, the man removes his penis from the vagina before ejaculating, also known as the pull-out method. Pros, can be used at any time. It's free. It's easy to use. And it can be used with other forms of birth control. The cons, it can be messy. The pre-ejaculation can contain sperm. There is no HIV or STD protection. And sometimes men have difficulty timing their withdrawal.
So thank you for listening to our presentation. We hope you've learned something from this. And stay safe out there.